Namaste. Uh, Welcome to all our viewers. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, edupreneur, and medical writer. On my pursuit of addressing, promoting, and propagating Ayurveda and psychotherapy globally, today I am here, to discuss on the significance and unique exclusiveness of ayurveda over other systems of medicine. Why should you choose ayurveda, and when should you choose ayurveda? What are the unique and distinguishing concepts of ayurveda which differentiates ayurveda from modern medicine and other systems of medicine? This topic is the most requested topic. I have got questions on this topic, that what is so special in ayurveda, you know what distinguishes ayurveda. So today we'll discuss all of it. And I have also got requests to do the sessions in Hindi and in other local languages, which I can. See, I can, do it in Hindi, Kannada, Telugu, and some other regional languages. But the problem is, what I'm experiencing is of time currently. So whenever I can, I will do some sessions in the regional languages as well as requested. So currently, it will be in English. So let's get started. See, ayurveda, as many people would know that ayurveda is 5000 years old, and it is the traditional and the first practiced medicine on this planet. So ayurveda is 5000 years medicine practice with its own multifaceted philosophy involving individuals' mind, body, and soul. This practice primarily based on disease prevention and treatment. See, Ayurveda's objective itself is, let me make it clear. Ayurveda states that swasthasya swasthya rakshanam and aturasya vikara prashamanam, and this is elaborated into aturasya vyadhi parimokshanam. I'll explain what this is. So, Ayurveda is the only system of medicine on this planet which, talks about prevention as its number one objective. So, to prevent, preserve, and protect the life of healthy individual, and to wipe out the disease from its root cause, or to treat the disease from its root cause, that is, we call it samprapti, pathogenesis in ayurveda, to wipe out the disease from its pathogenesis. So this is the main concept or the objective of ayurveda. And ayurveda, which means the science of life. So in the art, it is the art and science of living in harmony with the environment around us and our individual body constitutions, making it particularly pertinent in modern life. So I'll give you some strong reasons to why ayurveda is unique and is exclusive, and it is it is ayurveda is treats body as a whole. Ayurveda believes in holistic healing rather than the symptomic healing and the organ based healing. What happens in other systems of medicine, if you talk of modern medicine as well, they take one body part as one. Neurology is different, nephrology is different, cardiology is different, and like that, internal medicine is different. But in ayurveda we take a holistic approach, that is, ayurveda treats body as a whole. Ayurveda is not only one of the world's oldest system of medicine, but it is also holistic. Holistic is whole body in nature. Ayurveda embraces the whole you and acknowledge the connection between your mind, body, and soul. The how It is Ayurveda as much as it is physical, it is psychological and emotional as well. All the Ayurvedic diseases are, mentioned as psychosomatic. And the traditional medicine believes that creating this harmony can prevent illness, treat conditions, and contribute to a healthy life. And as I said, Ayurveda cures the root cause, not just the symptoms. So, the holistic medicine aims to restore health by understanding the underlying causes of diseases. It strives to attack the root causes and, uses. See, detoxify is a, vaguely used term. It is used anywhere and everywhere. Here, no, it is not that detox. Detox here is purification of the body, cleansing, strengthening body tissues, and balancing bodily doshas and ensuring complete cure. And Ayurveda is time tested Ayurvedic techniques. It has accurate diagnosis. It is as evident based as modern medicine. According to Ayurveda, we treat it dosha, dhatu, and there are significant, important concepts of Ayurveda that I will talk in this session later. But according to Ayurveda, the three qualities or the doshas form important characteristics of the prakriti or body constitution. See, Ayurveda approach is, unique and customizable. That means one size fits all approach is not applicable to Ayurveda, because, we Ayurveda history taking is a elaborate process. If you have any time gone to an Ayurvedic physician, you would have seen the history taking, the elaborate history taking, every detail from your, waking up to going to bed, whatever you do, all your dinacharya and your history of what you eat, what is your lifestyle, everything is taken into consideration while, diagnosing the disease. Why we do it is to classify the prakriti or the body constitution of the person, because everybody's body constitution is different. And how do we do it? We do it, we there are three doshas. Ayurveda is basically, based on tridosha theory, panchamahabhuta theory. So tridoshas are vata, pitta, and kapha. So by hearing vaguely, you might think, what is vata, what is pitta, and what is kapha? It has scientific explanations of what is vata, what is pitta, and what is kapha. What are panchamahabhutas? Panchamahabhutas are like your akasha, vayu, prithvi, your jala. See, the space and air, the fire and water, agni, and the earth. All these five pancha mahabhutas. Pancha is five, mahabhutas are what the earth is made up of. So when we treat in Ayurveda, we take all of these into consideration, and then it is diagnosed and treated. So the biological energies, these are the biological energies that govern all physical and mental processes, and its balance can vary from person to person. Influenced by genetic and lifestyle factors, Ayurveda uses the method of Ashtavida Rogi Pariksha, or eight methods for understanding an individual's doshas and disease diagnosis and complete cure. So the methods include Nadi. We do nadi pariksha, that is pulse examination, mutra pariksha, urine examination, mala pariksha, that is stool examination, shabda pariksha, voice, jihwa pariksha, tongue examination, sparsha, skin, drik, eyes, akriti is your body built or the constitution of the body. All these eight ashtavidha pariksha, ashtavidha rogi pariksha, this we call it in Ayurveda, in Sanskrit, in and these nadi, mutra, mala, shabda, jihva, sparsha, drik, akriti, all these we take into consideration while diagnosing a disease. And Ayurveda as a whole helps you to understand yourself. Ayurveda is not just a diet or an exercise program or a massage or spa. So it is a time tested body of immense wisdom that helps you understand and love yourself. So and Ayurveda emphasizes on both prevention as well as cure. The only system of medicine which takes prevention into consideration. That means preventing also as its main objective. That science is Ayurveda. So prevention is better than cure. So Ayurveda believes this as a core concept. And Ayurveda teaches a range of daily routines, that is called dinacharya, for complete control and balance of doshas. And for optimum health, dinacharya and rutucharya, seasonal regime, daily regime and seasonal regime are taken into consideration. That means what you have to do in this season, seasonal schedules are also prescribed in Ayurveda. So Ayurveda also lays down innumerable methods, medicines, and measures to permanently cure diseases and prevent future recurrence. So relapses and recurrences, prevention of relapses and recurrences is also an objective in Ayurveda. So Ayurveda, as you all know, people might think Ayurveda is only herbs. No, Ayurvedic treatments and medicines involves not only herbs but also numerous minerals and panchakarma, the purificatory therapies, all those are involved. Herbo mineral preparations, shamana and shodhana. Ayurveda is basically divided into two: shamana and shodhana. So shamana treatment is your medicines and the lifestyle and diet what you have to do. Shamana is herbo mineral preparations or whatever the dinacharya, the rutucharya and everything you have to follow. Shodhana is the purificatory therapies, that is panchakarma. I know most of you might have heard of panchakarma. So panchakarma is five therapies, that is vamana, virechana, basti, nasya and rakta mokshana. According to the disease, according to the person, according to the prakriti, according to the kala, taking into consideration of all these things, panchakarma is prescribed to a patient, um, uh, and according to the body constitution and taking everything into mind. And Ayurveda is not only a medicine, it is a lifestyle. It explores all the layers of life. Like Ayurveda plays an important role in one's pathya is diet and lifestyle, and physical exercise, mental well-being, dinacharya, rutucharya, everything, that is daily routines to improve the overall quality of life, daily routines and seasonal routines. So, then Ayurveda treatments are mostly cost effective. So Ayurveda, maybe it is not just the ancient medicine, but is also most effective and the safest. And cost effective is, it is almost reasonable compared to expensive, Western drugs. But and some of the preventative measures can also be found in your kitchen as well. The ingredients can also be found in your kitchen. But next, Ayurveda has no adverse effects. See, there is a difference between side effects and adverse effects. See, I'll tell you, Ayurveda may have side effects when a wrong medicine is prescribed to a wrong patient, when it is taken wrongly, or a wrong herb is prescribed, or a wrong herbal mineral preparation is prescribed to a wrong disease or wrong prakriti. It might happen. Or if the it all depends on yukti, the intelligence, and the wisdom of the doctor. And but Ayurveda does not have not seen adverse effects. Adverse effects is possibility of death or serious complications. However, Ayurveda has not, we have not seen any cases of adverse effect or serious events in Ayurveda, because we don't use in Ayurveda, chemicals are not used. And you and it takes it is not like it is not a magic pill where you take a pill and you reduce the pain. In Ayurveda, that concept itself is not there. So Ayurveda medicines, however, take time, but you will start noticing difference within a few days after, once you start taking medications and once you start the treatment. So it is a myth that Ayurveda cannot have side effects. No, no, Ayurveda may have side effects if prescribed wrongly, if the wrong dosage is given. But Ayurveda, however, has not seen adverse effects, serious effects of death and something like that. So, as I said, Ayurveda is advantageous, see, because it has personalized treatments and natural remedies, and emphasis on prevention, holistic approach. These are some of the, as I said, and it is a time tested tradition. Ayurveda has a long history of use and evolution, which provides a sense of credibility and trust. And many researchers in nowadays, many researchers and randomized control trials are going on different drugs of Ayurveda. So, and Ayurveda is an integration of body and mind. As I said, Ayurveda recognizes the interconnectedness of the body and mind. Mental health and emotional well-being are considered essential aspects of overall health, and Ayurveda offers practices to address these aspects. See, we call it Sattva Vajaya Chikitsa in Ayurveda. That is what I do. The psychotherapy, Ayurvedic psychotherapy, is called Sattva Vajaya Chikitsa. So, it takes care of the mental health and emotional well-being aspects. They're also called Mano Roga Chikitsa or Mano Vikara Chikitsa. So, after this, see, despite these advantages, it is important to approach Ayurveda, and with a consult. You have to consult a qualified, practitioner. You have to see. Don't take Ayurvedic advice from anybody who tells you take this, take that, or some random influencers. Please go to a qualified Ayurvedic doctor, BAMS or BAMS MD, and the doctor, and then can uh, seek help. So, and Ayurveda is also complementary to modern medicine. If you ask me, see, I will talk about when you should opt for Ayurveda and when you should, not. But complementary to modern medicine, many individuals and in many cases, there is integrative approach. That means you can combine Ayurvedic practices and medicines with modern medicines. In a few of the cancer centers, there are allopathic treatments going on by and as well as the Ayurvedic treatments for the same patient. for palliative care for different conditions, and we can combine. It is not, Ayurveda is not against modern medicine. We go complementary sometimes. We have to see the history and the comorbidities and everything, taking into consideration everything, it can be complementary to modern medicine. And Ayurveda promotes lifestyle changes, as I said. There are so many lifestyle modifications, and diet and lifestyle can cure so many diseases we experience in everyday life. See, every system of medicine has its own strength and advantages, and also some limitations as well. And now if I come to what are the the special concepts of Ayurveda. You see, Ayurveda is a traditional system of medicine with its own unique and exclusive concepts. So I'm talking about exclusive concepts now. So these concepts form the foundation of Ayurvedic philosophy and guide, is a approach and guide its approach to health and healing. So Pancha Mahabhutas. So what are Pancha Mahabhutas? I've just mentioned them earlier. See, Ayurveda believes that the universe is composed of five fundamental elements, that is Akasha, Vayu, Agni, Jala, and Prithvi. Akasha is space, Vayu is air, Agni is fire, Jala is water, Earth is Prithvi. These elements combine to form uh, Tridoshas, that is Vata, Pitta, and Kapha, which govern the body's physiological and psychological functions. So, Tridosha. Three dosha here is Vata, Pitta, and Kapha are the three biological energies or doshas present in every individual in varying proportions. Health is believed to be maintained when these doshas are in balance, and disease occurs when there is an imbalance. So, health, the definition of health in Ayurveda is samadosha, sama agnishcha, samadhatu malakriyaha, prasanna atma indriya manaha swasta ityabhidiyate. So samadosha, when doshas, vata, pitta, kapha, and we have manasika doshas as well, rajas and tamas, and manasika gunas, sattva, rajas, and tamas. When these physical and psychological doshas, vata, pitta, kapha, and rajas and tamas with sattva are balanced. Sama dosha, sama agni. Agni is when your digestive fire and your digestion and metabolism is proper. Samadhatu, when the tissues of the body are properly nourished. Dhatus are seven in number according to Ayurveda, tissues of the body. So, Samadosha, Samagnishta, Samadhatu, Malakriyaha, all your, urine, stools, and all the excretas of the body are, expelled properly. So, Samadosha, Sama Agnishta, Samadhatu, Malakriyaha. Then, Prasanna Atma Indriya Manaha. See, Prasanna Atma is the soul, peace. You can take it as peace. Indriyas are the sense organs, all your five sense organs, and your five jnanendriyas, we call it jnanendriyas, and five karmendriyas. Prasanna Atma Indriya Manaha. When your mind and when you're emotionally well, emotional well-being, this refers to the health in Ayurveda. Everything, Samadosha, Samagnishcha, Samadhatu, Malakriyaha, Prasanna Atma Indriya Manaha, Swasta Ityabhidiyate. So this, and in Ayurveda, the third, unique feature is Prakriti. Prakriti is refers to an individual unique combination of doshas that is established at the time of conception. Understanding one's Prakriti helps tailor personalized health recommendations and treatment. And as I said, seven tissues, Sapta Dhatus. Ayurveda recognizes seven fundamental tissues in the body. That is Rasa, plasma, Rakta, blood, Mamsa, muscles, Meda, fat, Asti, bones, Majja, bone marrow, and Shukra, reproductive tissue. So all the seven tissues, these tissues form the basis of the body structure and function. This is similar to what is said in the modern medicine as well. So this was prescribed or mentioned in Ayurveda 5000 years ago. So Agni, Sarve Rogaha Mandagnam, that is said in Ayurveda. Every disease, the root cause of every disease lies in its digestive fire. It is digestive, it is one way or the other related to the metabolism and digestion. So Agni represents the body's, Agni is called digestive fire, represents the body's digestive fire responsible for metabolizing food and maintaining overall health. Proper functioning of Agni is essential for efficient digestion and assimilation of nutrients. So, Ama is also a unique concept in Ayurveda. What is Ama? Ama is toxicity. That is accumulation of waste, you can say. Ama refers to the accumulation of toxins and waste resulting from improper digestion and metabolism. It is considered a root cause of many diseases in Ayurveda. So all this, and ojas is very much, ojas is also an important concept. Ojas is somewhere referred to vital essence or the immunity we talk about. So ojas is the subtle essence that represents the body's vitality and immunity. It is considered the most refined product of digestion and is responsible for overall well-being. So ojas, the immunity, the vitality and the immunity, this is responsible for the overall well-being. And there is another interesting concept in Ayurveda, which is, prana. Prana is the life force or vital energy that governs all physiological and psychological functions. So proper balance and flow of prana are essential for good health. And the last but not the least concept, which is very famous and unique in Ayurveda, is rasayana. Rasayana is rejuvenation. So rasayana therapies aim to promote longevity and rejuvenate the body and mind, supporting overall health and well-being. Rasayana therapies are also widely used, to increase the immunity of the patients in several diseases, including, cancers and malnutrition and sexual disorders, whatnot, and to, in geriatric disorders as well. So rasayana is also a unique concept in Ayurveda. These exclusive concepts form the basis of Ayurvedic diagnosis and treatment. Ayurveda focuses on restoring the balance of doshas, eliminating toxins, and promoting a harmonious relationship between the individual and the environment for the optimum, health. It considers each person as a unique entity and provides personalized recommendation for diet, lifestyle, herbal treatments, herbo-mineral treatments, purificatory therapies, that is detoxification therapies based on individual needs. So, after all this, you will ask me that when should I consider, or what are the conditions for which, I must consider Ayurveda, or I should choose Ayurveda. See, Ayurveda has some limitations. Some of the emergency or acute treatments are not being continued or practiced today in the modern times. But Ayurveda as a holistic system of medicine addresses a wide range of health conditions. While it may not be the primary treatment for all the medical conditions, so it is not the alternate. So Ayurveda, as it is said, or known, there is, it is a myth that Ayurveda is a alternative system of medicine. No, Ayurveda can be a mainstream medicine for so many, so for many disorders and diseases. So we let's see some of the diseases or some of the conditions wherein you can, definitely choose Ayurveda over other systems of medicine. If you have any digestive disorder, see, for all the chronic illnesses, the one formula is for all the chronic illnesses, you can go to Ayurveda. And as soon as you can approach Ayurveda, the treatment is as easy and the disease is as curable. If you delay going to delay, then it might take prolonged period of times. So some digestive disorders, see, digestive disorders, all the digestion related disorders are mostly treatable in Ayurveda. Veda, for indigestion, for constipation, for acidity, for irritable bowel syndrome, for many other gastrointestinal issues. If you have any, please consult an Ayurvedic physician. Next, musculoskeletal disorder. Ayurvedic therapies like Abhyanga, Basti, and Abhyanga, Basti, external procedures, panchakarma, and herbal preparations are can be to a greater extent manage arthritis, joint pains, back pains, and all the related diseases of musculo and skeleton. Like if you have chronic arthritis, pains, backaches, sciaticas, all these conditions can be treated through Ayurveda. And respiratory disorders, Ayurvedic treatments yeah, are have significantly shown to be effective in asthma, bronchitis, and many other respiratory conditions. So if you have chronic respiratory illness, you can approach Ayurveda. Skin diseases, Ayurveda specializes and addresses skin diseases. In skin diseases like acne, eczema, psoriasis, dermatitis, and so many other skin disorders can be treated through Ayurveda. So Ayurveda specializes in skin disorders. And stress and anxiety, so many mental health conditions like depression, stress, anxiety, OCDs, your traumatic post traumatic stress disorder, many other mental health conditions can also be managed by Ayurvedic practices, and inclusive of meditation, yoga, and all the Ayurvedic herbo mineral treatments and counseling, the Sattva Chikitsa. So mental health conditions can also be treated. And hormonal imbalances, see, Ayurveda helps in especially in females. Ayurveda specializes in female gynecology, that is managing PCOS, polycystic ovarian syndrome, hormonal fluctuations, and other gynecological disorders. This is a specialty in Ayurveda. Next, metabolic disorders. Metabolic disorders can be treated through diet, lifestyle changes, and Ayurveda specializes in endocrine disorders like diabetes, obesity, and all the thyroid, etc. All the metabolic disorders, and some of the metabolic disorders can be treated effectively through Ayurveda. And the urinary tract disorders, Ayurveda also helps in managing variety of urinary tract infections. Next, as I said, gynecological disorders. Ayurveda specializes in gynecological disorders, and in males, the sexual disorders as well. So erectile dysfunction and etc. All the sexual disorders also majorly can be cured by Ayurveda. Liver disorders, Ayurveda treatments can help into a greater extent to manage liver function and manage conditions like fatty liver. And next is neurological conditions. Ayurvedic therapies may be used as a supportive care, or to a greater extent manages neurological disorders. And it can also well manage migraines, epilepsy, and related disorders. And eye conditions, Ayurveda also specializes in eye treatments, for myopia, hypermetropia, netra tarpana. All the techniques are taken into measure, eye treatment techniques to cure ophthalmology disorders. and ENT as well. Most of the ENT disorders can also be treated through Ayurveda. And Panchakarma, of course, it helps in detoxification and rejuvenation and immune support. So if you have any immune compromised disorders, then also Ayurveda can manage many of the immune compromised disorders. So, integrative or integrating modern Ayurveda with modern medicine under the guidance of qualified practitioner can provide a comprehensive and holistic approach to health and well-being. So, always consult a healthcare professional, before starting any new treatment. Don't self-medicate, and this this is it, I think, for the today's session. All systems of medicine have advantages and limitations. Ayurveda has advantages and limitations, as I said. See but with all these exclusive and unique features, Ayurveda outstands all other systems of medicines. So, and it can be safely considered as the mainstream medicine for most of the diseases and disorders. So that's it for today. Thank you for staying tuned, and namaste.